My name is Catherine Laing, and I'm an assistant professor in the Faculty of Nursing.
So, Dr. Laing, what do you do? What is your research about?
Well, my research is partially in the field of pediatric oncology and partially around something that might fall more under the umbrella of health economics. So, firstly, with pediatric oncology, I'm looking at ways of making the experience a bit easier for children and families that are going through that, and perhaps even lessening some of the long-term side effects that come along with treatment. And then secondly, with respect to the health economics branch, I'm interested in how we can understand value in healthcare, both financial and social. So I'm assessing the feasibility of using something called a social return on investment as a way of doing this.
And why does your research excite you? What makes it interesting?
I'm really interested in both words and numbers. I really like to understand the human experiences and then translate them into a way that's understood by people. Sometimes that's words, sometimes that's numbers, and sometimes that's both. So for me, getting to use both words and numbers, or qualitative and quantitative, some might say, is fantastic because I really feel like I have the tools to do that.
And how will it change the world?
Well, healthcare is perhaps one of the most complex systems that there is. And I think that regardless of where one lives in the world, there's just no denying that the system of healthcare is quite poorly understood. And it's not uncommon to hear of programs being cut and then reinstated. And I think that a lot of this has to do with us not having the right information to understand what we're dealing with. So social return on investment is a way of understanding all of this value in healthcare, because so much of the value is social in nature versus financial. So on paper, if only financial needs are considered, most healthcare programs don't look very good. And so once you can start to factor in social value, a very different picture can be painted. And this can lead to a much more robust understanding of service delivery. So I think that this will lead to more informed decision making at the policy level.